We have a wonderful new edition in January to start out the new year in American Journal of Psychiatry, and I would encourage readers to look at the broad mix of papers that are featured. There's tremendous interest in developing biomarkers that can be used to predict clinically relevant outcome variables. And autism spectrum disorders represents an area where there's particular interest. Webb and colleagues bring together some of the world's leading scientists to review data in nearly 400 children, including some with an autism spectrum disorder and some who are typically developing. And the authors asks, how close are we to having biomarkers for the diagnosis of autism? The authors examined some of the best measures we have from electroencephalography, and the conclusion suggests that we're getting close, but we still have some ways to go before we have biomarkers. One of the uses of brain imaging is to relate measures of brain function to measures of treatment outcome. Block and colleagues use resting state functional fMRI data to ask questions about the relationship between psychotherapy treatment response in obsessive compulsive disorder and brain function. And three main findings come from this important new study. One finding suggests that there might be aspects of brain function that relate to specific forms of psychotherapy and the outcomes associated with them. A second finding suggests that there are other findings that might not relate specifically to psychotherapies of one or another variety, but to the response in general to various psychotherapies. And then the last lesson suggests that the age of the patient influences these findings related to brain function and clinical outcomes following psychotherapy. It's important to note that these findings are promising, but they're not quite at the stage where they're going to inform clinical practice.